Hi there, I'm Dr. Guy Carnazza, and I practice in the town of East Rockaway, New York, and I'd like to welcome you to Discover What's Possible. Today I have a treat for you, and I'd like to share with you a case that we recently completed. I have a 67-year-old male who came to us with the chief complaint that he was very unhappy with the appearance of his smile and the appearance of his teeth. So what we did with the power of a smile design and smile makeover, we were able to redesign his smile with a combination of porcelain veneers and porcelain crowns. And not only did we redesign his smile, we eliminated disease, improved his function, and gave him an overall smile makeover. So I'd like to share with you how we did this today. So when we examined this patient's teeth, we noticed that he had lots of old bonded fillings with decay, an old unesthetic crown on one of his very front teeth. But one of the major things that we noticed was his poor occlusion, or the way his teeth came together, or what we call his bite. His upper teeth and his lower teeth did not meet in an ideal manner, meaning that his upper teeth came into what we call a crossbite, where the top teeth came underneath the bottom teeth. And what we had suggested to the patient was to consider maybe doing some orthodontics. And at 67 years old, he was not too keen on doing something like that. Because when we examined his mouth further, we saw a lot of these old silver fillings on his back teeth, and we could see a lot of wear and tear because they were not in proper function. So if we look at the patient's mouth from a side view, we can also see a lot of these old bonded fillings that were breaking down with decay. And then again, the poor function of his teeth. So we had proposed to the patient to do a full mouth rehabilitation, but he was really only interested in doing his top teeth at this time. So what we did with a mock-up of the teeth, what we call a wax-up, and communicating with the laboratory, we came up with a plan to do a combination of porcelain veneers and porcelain crowns on his upper teeth to redesign his smile and redesign his bite. And we had shaped and prepared his teeth and placed them into a temporary, which he wore. And this temporary was based on the mock-up, which the patient wore for a couple of months just to get used to the new bite. Because what we had to do was bring out those posterior teeth and some of the anterior teeth into proper function. They were angulating in towards the tongue, and he wasn't getting proper function or use of those teeth. It was causing them to break down and wear. So by building out those teeth, we were able to restore a better occlusion, a more ideal occlusion or bite. And as you can see in this final photo, we were able to restore not only beauty with nice aesthetic porcelain crowns and veneers, we eliminated all of the disease of all the decay that was in his mouth and that failing front crown. We also improved the function. We gave him a more ideal bite, which we would not have been able to do normally unless we had done orthodontics. But we were able to do it with restorative dentistry, with this smile makeover. And the patient was ecstatic. He was so happy with his new smile. As you can see, he couldn't stop smiling. In fact, a lot of people asked and they said, there's something different about you, is what he told me. They really weren't quite sure what it was. And he told me he felt that he had taken 10 years off his smile just by doing this smile makeover. And he was very, very happy with the end result. So that's Discover What's Possible. If you're interested in recreating your smile or having a smile makeover done, you can call us at 516-887-3550. We'd be happy to do a free consult. Or you can go online at carnazzadental.com and see a lot more of our cases before and after. We're located in the town of East Rockaway, so if you're in the greater New York area, we're only 20 minutes from JFK International Airport. Come on in, stop by, and we'd be happy to help you. We'd like to say thank you, and we'll talk to you soon.